Okay, so excuse the scary bedhead, but I am definitely on my way to bed. I wanted to just follow on from, just to do a few videos about the conference that I just went to, and what I found really interesting about my own experience of what, you know, getting there and having this big thing to do, but also what I found in the conversations there and the other presentations and speeches that people did. And a lot of them were from professionals really working hard in the field to change services, partly because that I think the system is really having to, the money isn't available, resources are, you know, underfunded, staff are getting harder because they're dealing with the same kinds of issues, stress and whatever. But what was really interesting was a lot of the discussions about how systems are changing because of this, how they're having to become more creative and inventive. And I think that's a really good thing. And that was partly the reason I think that they had me there, was to show people that change is possible from people who are determined, given the right information. Now, I didn't really have any of this information. I was young. My GP kind of even questioned why I was using supplements and nutrition to try and support my immune system. He didn't really know how that worked. Now, this guy had known me since I was a baby. I had, you know, thyroid eye disease, which is like it's like a swelling, I suppose, in your eyelids pulled back, and I still get symptoms of that now. And when I said to the consultant about taking selenium to help that, he just sniggered. So I had a lot of that, and that really came up in, you know, when I was doing the speech, that you don't really want to be laughed at, and that's been my experience, and that lives in my system a little bit too. And that point about reducing steroid use and the risks that over medicating and using medications for chronic illness really are. And I see a lot of this. I'm on a lot of thyroid support groups, and it's very much like with Hashimoto's, a lot of it is very much about, well, I'm on the medication, so I'm fine. But there isn't this thought of this possibility that actually you can get well from certain things. You can live really well, you can be in remission. Yeah, there's often a risk to get back and forward, but I think I was there as an example to show people that it is possible to live a happy, healthy, whole life, and actually help others. That was the main thing, really, just by taking things into your own hands. So this is the work that me and Jen offer within the Voices of Lived Experience, and we've got one of our Recovery in Action webinars next week, but we've got this workshop coming up on the 22nd of November that's really the stuff that we've learned, not only through our own study and our own skill finding, the way we've worked through it. A lot of the time we've developed those skills because we're learning about our own bodies and what we needed at the time, but our own lived experience of what worked and what didn't. Now, we know that everyone's journey is not the same, but this theme of empowerment in your diagnosis, it can be like really scary when you receive a diagnosis of chronic illness, but there are ways to repattern yourself and to live more healthily and to have a better life, really, and not by fighting it with medication. So I just wanted to really just keep popping on as much as I can to keep talking about this, because, you know, the NHS and a lot of other systems are really under a lot of struggle, and they are really trying to understand it. And so people like me and the Voices of Lived Experience, they're really showing a lot of healthcare professionals that things can be done, that it's not so frustrating, that there are other options, and using us as an example to other people. So me and Jen would really love you to be there. You don't have to have a chronic illness or a diagnosis, but you might really be struggling maybe with some you know, mental health stuff up and down, a bit of burnout, and finding that it's kind of chipping away at your health in a little way, because if our physical health is bad, then our mental health can be bad as well. So really hope that these videos are making an impact, even though they might be a little bit waffly, but I'm just kind of going through it and trying to guide people, because I think it was a really important event for me, but I think it's a really important thing to keep talking about and sharing stories, you know, to build kind of that bridge between the system and the story. So if you'd like to join me and Jen for our Pillars of Health workshop, then that's on the 22nd of November. I'm not even going to say the name because I always forget it, but all the details are in my link tree. So please come and join us, and we're going to be sharing all our knowledge and having a bit of a giggle and getting to know some people together as well. So we'll see you there. Take care.